Hi, today we are going to discuss about verbal report. I'm Ms. Jhansi, tutor working at Triple M College of Nursing. At the end of the session, the learners would be able to define what is oral or verbal report, how it should be and its examples, what it should contain, and a telephone report by this bar method. Okay, so an oral report is a verbal communication of relevant information to colleagues, superiors, or team members. It is often less formal, but it requires clarity, consciousness, and structure to ensure effective communication. How it should be? It should be professional, brief, accurate, relevant. No slang or gossip should be there. Respectful of the patient and person who are reporting to. Examples of informations are shared are falls, chest pains, severe headache, difficulty in breathing, abnormal vital signs, change in the mental status or loss of consciousness, sudden weakness or loss of mobility, high fever, bleeding, bruises, abrasion, or signs of possible abuse. What all it should contain? It should have an introduction first. So clearly state the purpose of the report. Next, there must be a body, the content. Present the main points of findings focusing on the key facts. At last, it should conclude with a summary and recommendations or any steps to be followed or carried out next. Offer an opportunity for the listener to ask questions or clarify the details at the end. So it should contain an introduction, body, and conclusion. Let's see an example now. So this is the ISBAR method, the situation where you have to identify self, cite a unit or person calling from, identifying the individual with name and date of birth, symptom, onset and its severity, that is a situation. The background details containing time and date of admission, admitting diagnosis, relevant medical history, lab and diagnostic results, notable changes if any. Then comes the assessment. Here, suspected underlying cause or concerns to be assessed and briefly explained. Then the recommendation. Recommendation and expectation should be very clear and specific about urgency of request and expected the time frame. What is a purpose? Communication tool to structure conversation about medical situations requiring an immediate attention and action, reduces errors and encourages assessment and decision making skills. Examples. Situation. Good morning. Dr. X, I am Mrs. Y calling from an emergency reporting on Mr. John, a 65-year-old male who was admitted yesterday for chest pain. For example, this is a situation. What is a background? So the background should contain the patient has a history of hypertension and type 2 diabetes. He was brought in with severe chest pain and shortness of breath. Initial tests suggest myocardial infarction. And what is the assessment? His blood pressure was elevated at 150 by 95 mm of Hg, heart rate at the rate of 110 breaths per minute, and his ECG showed ischemia. He received nitroglycerin and aspirin, and his troponin levels were high. He was transferred to the ICU for further monitoring. What is the recommendations? I recommend keeping him in the ICU for continued observation with plans for an angiogram later today. Would you like to review his case before we proceed? So, here a situation has been discussed with the background of the patient and what a nurse has assessed, and the recommendation from the doctor as well. So, this is a verbal report method in ISBAR. Telephonic report. So what is telephonic report? Sometimes you may have to give a verbal report over the phone. So whenever possible, talk to the person directly after you receive the verbal report through telephone. Your telephone report should be very professional, brief, accurate, and documented in written form as well. Hope you understood the topic. So these are some of the references taken. Thank you.